Welcome to LifeLine, this is Jay.
And Ilya.
We're both sixth form students and we started this channel aiming to help students applying to medicine or healthcare who struggle with writing reading, uni application and just studying in general. So let's start by introducing ourselves. I'm Jay, a year 12 who's studying biology, chemistry and maths. I've just finished GCSE, so I've just started sixth form for a few months. Ilya and me are here to share and monitor our progress throughout sixth form, and we're going to share research and writing reading, mostly biomed related for me because that's the field I want to get into, and we might also give you guys some studying tips. Having seen lots of amazing YouTubers like Ali Abdul and Faith Film that surely impact students' life, I just thought that doing videos would be a great idea to help students in similar condition as Ilya and me, as well as boosting our presentation skills. These are the three subjects that I generally love and good at. I've always been passionate about biology. For me, it's really fascinating to know how the body works and how different functions interact and therefore form the complete version of what we are. And by the way, I've recently started reading a book called 10% Human by Leonard Holland. My biology teacher actually recommended this book to me, and it's amazing, as it tells you how human is not mainly composed of human. It's a bit paradoxical, but actually I might make a video on this after I finish it, which might take ages, but I'll try. Math is one of the best. I'm absolutely addicted to how I get sink into my own world when I'm solving math questions. I can get into that workflow for hours without noticing anything. It's truly satisfying, especially when you tackle a difficult question that has been bothering you for so long. For chemistry, it's like a combination of biology and maths in my opinion, as they're deeply correlated. For example, like the numeric and practical skills that are essential in biology and math. So I will be brutally honest that chemistry wasn't my favorite among my threes, but there are still a lot of times when I love it. Additionally, I'm a member of the Bioresearch Society in my school, which is led by Ilya, and I'm also applying for the Whittier Biometric Diploma this year, which she will talk about. We actually just met recently, but she really supported me a lot. I'm quite clear that I want to do medicine related subjects since secondary school, and I'm subscribed to the Platinum Pathway of Medic Mentor, which gives me a really early start in year 10. Medic Mentor is led by a group of doctors who volunteer to help medical students in their journey. For example, they hold virtual medical society every single week, which is actually led by a committee of people in medical school, sixth form and even secondary school, which gives us a great opportunity to enhance our leadership profile. The committee will also cover wider reading topics like definition of medical words and even critical topics like medical ethics and use of AI, as well as useful infos like working experience, volunteering. They also offer guest speaking opportunities, which can be very beneficial to your profile. By the way, the Platinum Pathway is not necessarily a paid program, so it could be paid by bursary if you're eligible of. In the leadership program, I get into small groups with current healthcare professionals, and in my case, it was 2 to 2, which you get to receive advice from them about the presentation skills after you gave a presentation. And we also have a guest speaker from Cambridge University talk about PowerPoint making and hand gesture in general, which are essential skills to become a successful leader. In the Platinum Pathway, you also get to have a 2-night stay in one of their organizations to finish your personal statement, and also we have one-to-one unlimited UCAT tutoring and first aid training, etc. I also attended 5 sessions of allied healthcare working experience, co-organized by the NHS and Medic Mentor, which is a 6-month scheme. These has allowed me to gain a lot of insight about just the hospital setting in general, and you can get to learn different cases of how the multidisciplinary team evaluate and treat a patient, including speech for a specific healthcare professional, like dietitian, midwife. These can be very helpful in exploring what field exactly you want to work in. I personally find prosthetics quite interesting, even though I eventually decided that it's not really for me. It's not like a famous field, but our chief mentor, who specializes in prosthetics and orthotics, gave a tiny speech about it, and it's quite creativity focused. The job generally allows more work-life balance than other healthcare occupation, and it's good to enter the program if you think that this might suit you. It is held again this year, and I believe the first session is over right now. Kind of. I also participated in the Get Into Medical conference, which is completely free, by the way, and you get to receive a certificate afterwards. We got a few guest speakers studying in medical school like UCL, Cambridge, Oxford, talking about the experience in application like preparation of UCAD, essay competitions, study tips, etc. I've also done some fundraising in response to the scheme of Medic Mental, which I started my own fundraising website for children cancer charity. You're very welcome to support by donating through the link at description box. Let's pass it on to Ilya.
My name's Ilya Krim, and I'm a Year 13 student studying biology, chemistry and computer science. I've always been a curious person, and I've always wanted to know more about things, so biology and chemistry was an easy pick for me. I really like sciences, but I often struggle with content. I'm not the best person at biology on paper, and I still struggle with it now, but I like it a lot, so I use that to push me to revise when I don't feel like it. Chemistry has been a love-hate relationship from the start, really, because you can memorise the whole textbook, but if you can't apply your knowledge, you're done for. I found that really annoying in GCSE, because all my GCSE revision was rewriting the CGP textbook, for most subjects anyway. But that method was still getting me around about 45%, while everyone else in my set was getting 80%. My teacher noticed that every single time I got my results back, I would essentially shut down, and I wouldn't really talk about it. She took me outside the room and started telling me that she had her own problems with chemistry at GCSE and A-level. But told me if I start to do exams, look at mark schemes and do time practice, I'll eventually get better. In the end, I nearly managed to get an 8 in A-level from a 5 in the previous mocks. Now that talk with my teacher helped a lot for A-level chemistry, and after doing exam papers I've noticed trends in different papers, and what topics like to interlink with each other at A-level, like Group 2 and Group 7 link with redox. Now computer science. It's funny really, because I hated computer science in GCSE. Like, I liked the theory, because I found it easy to memorise and go into the exam, but the coding was horror. Like, the program will not have any errors, but one small thing and you can delete the whole program, or it won't work the way you want it to. As soon as I understood how the code works a week before my exam, everything changed. Well, not everything exactly. My coding is still temperamental here and there, and I still spend hours staring at my code, wondering why the sign-up system won't store the data into the table. But then you figure it out. And it's because you mistyped the field name. A-level computer science sounds scary, especially when there's only 2 girls in a room of boys. But it kind of creates a sense of like women in STEM determination. For my computer science coursework, I'm creating an AI revision tool that focuses on scheduling revision using calendars and timers, as well as active recall, by importing your notes and using an API key to an AI to generate questions, answers and feedback based only on those notes, and use inputs like number of questions, types and difficulty. My favourite part of the program so far is my Pomodoro timer. Sometimes when I'm using this technique myself, I always stare at the time left until the next break. But I've added a visual progress bar that looks like a candle, so as you work and the timer goes down, you see the candle burn. Now, outside of academics, at my school we do something called STAMP, where you can give back to your community by helping younger students with reading, lessons or even helping out at the local primary school. Since Year 12, I have been doing in-lesson support for DT and computer science. When I was doing these subjects myself in GCSE, I noticed that a lot of students didn't understand certain parts like the assessment structure or even the NEA coursework. For DT, even all of it. Helping in GCSE DT and computer science has really helped me grow confidence and teach students the things that got me through my own GCSEs, like active recall, taking effective notes and making a little coding dictionary, as well as things that I would like to have had in general and had support with, like how to be confident and dealing with 11 subjects. I even got to present my own NEAs at Exemplar and tips to the theory exam for my DT GCSE sets. Like Jay did, I also did 6 of the Virtual Allied Health work experience courses, and they were surprisingly good. To be honest, I only did it so I can have some form of work experience, as I couldn't find any due to safety restrictions and heaps of paperwork for hospital and lab work experience. I found it good, because of the simulations and the fact it covered a wide range of different health professions and the case studies it had. I believe since in-person science work experience is difficult to get, virtual work experience is treated the same. I learned about how important communication and wording is when talking to a patient, as the patient may be worried and want the procedure explained calmly in simple words. Or the patient might be verbally abusive, in which you should acknowledge their feelings but clarify that the behaviour is unacceptable and provide a viable solution. I'm the founder of Bio-Research Society at my school, where we explore biology outside a textbook. We have practical sessions, presentations, debates, quizzes and wider reading projects. It's a space for us to connect as well as talk about post-sixth form plans, revision tips. We even host revision sessions close to exam season. Like Jay mentioned, I have participated in the Whitgift Diploma of Biomed in Year 12. It was an introductory weekly course consisting of 8 undergraduate biomed lectures and a brain dissection, followed by a 2-hour-long exam, which happened to be the day before my birthday, with topics surrounding anatomy, physiology, neuroscience, pharmacology and developmental biology. Now, I wasn't super confident going into the course as I felt a bit intimidated by everyone else taking the course. But I didn't give up, because I chose this for myself. So after a lot of note-taking and recall, I managed to get first place with 92% in the exam. This experience will be the main topic source for our channel. I've also done radiography work experience in a hospital, which has given me insights into machines, interface and how hospital staff communicate. I got to shadow radiographers and radiologists, HCAs as well, for 5 days, into multiple modalities, like X-ray, MRI, CT, ultrasound, nuke med, DEXA fluoroscopy, even. It was hands down one of the coolest things I've ever done. I've saw everything from MRI emergencies with an epileptic patient having a seizure in the machine, observing how staff deal with verbally abusive patients, looking at core scans of people with bullet wounds, ingested needles, and even learning how to move the hybrid angio CT scan in IR. It was really interesting to see the behind the scenes role of a radiographer, looking at all the machines, interfaces, but it was also my first time in hospital, and I wanted more range in terms of workplace environment rather than only being in a hospital. So from there I've decided I would like to study optometry next year in uni and be an optometrist. I think this is best suited for me since I'm a practical learner who likes anatomy and scanning and most importantly healthcare. In terms of hobbies, DT is very close to my heart. I love it so much. It allows me to dream up an idea and think about how we'll join together, thinking about the process. I don't really know why, but I don't really like using machines to cut wood, and I just like using my trusty coping saw, my tenon saw. I think it's that feeling of, oh, I made it myself. I might have made a mistake, I might have caused a dent, but I did it. People often think that a DT is a weak subject, but under all that creativity is a load of problem solving, product testing and market research. I also like taking care of my plants. I got 2 jade plants, succulents and 4 orchids. I'm trying to propagate the succulents and jade plants, and I think it's going really well. In general, I've noticed I like admiring on what I have made or what I've done, which I think is very important and will have a good impact in the healthcare field.
Let's go to our caller today.
Hi.
Welcome to LifeLine. We aim to offer support to medical and healthcare students. What can I help you today?
I'm really struggling with anatomical terms like body planes, movement, and then their musculoskeletal systems. It would be really nice if you can help me with them.
Don't worry about it. Let's break it down. Whenever we describe the human body in anatomy, we imagine it in standard anatomical position, where the body is standing upright like a soldier with his palms facing outward and his thumbs pointed away from the body. Now, in order to describe location and direction of bodily structures, we'll use body planes, which are like imaginary lines drawn through the standard anatomical position.
It's almost like the direction in which a killer would cut someone with a chainsaw.
Yeah, exactly. There are 3 main types of planes: frontal, also known as coronal, sagittal, and transverse.
You can remember it using the acronym Feel So Terrible, because it is so scary to be torn apart by a murderer. So feel F frontal, so, S, sagittal, cerebral, T, transverse.
Frontal and sagittal body planes are both examples of longitudinal planes, which are perpendicular to the transverse plane. Frontal or coronal body plane is where the serial killer will cut you in the position of someone wearing a headband, so they will be left with the front of your body called the anterior or ventral, and the back called the posterior or the dorsal. That's why on the back of a dolphin you have a dorsal fin, since it's on the back. A sagittal body plane is a body plane that's cut along the central parting of someone's hair, with your arms part of both sections. If a cut is directly in the middle, it's called a mid-sagittal and follows your body's midline, but if it's slightly off-centre, it's called a parasagittal. The other two words you need to note for sagittal planes are medial, which is closer to the cut, and lateral, further away from the cut. A transverse body plane is like a bird's eye view of a person being, well, shot. The upper parts of your body, like the head, is superior to the lower parts of your body, also known as inferior. You can also have oblique planes, where they are not horizontal or vertical and are at diagonals. Now try yourself. Match each picture with the respective body plane.
Coronal, sagittal, and transverse.
Impressive. Yes, that's absolutely correct. Now you get body planes, time to talk about directional terminologies. They're used to describe the location and position of body parts in relation to another. So basically, your trunk is your torso, where all your limbs connect. When you say a part is proximal, it's closer to your trunk than something distal, which is further away from your trunk. For example, your shoulder is proximal compared to your wrist.
You can also use proximal to describe structures that are close to the origin, like in tubular structures being proximal. Simply means close to the start point of the structure itself.
When you get a paper cut on your skin, it is known as superficial as it is close to the surface. However, a bullet would be considered as deep, as it is away from the surface of your body. The next word is ipsilateral, meaning that on the same side of your body, like two wounds on the same arm. The opposite of something contrast, so contralateral means an opposite arms, like one cut on the left arm and the other on the right.
Plus, unilateral means only one side and bilateral means two sides. You can identify this by looking at the prefix bi, meaning two. Simple.
So here's a photo. We can see that the person's hip is superior or inferior to the skull.
Inferior.
Good job. The brain is anterior or posterior to the nasal cavity.
Anterior.
Perfect. The rib is medial or lateral to the shoulder.
Medial.
Fantastic. Now describe the position to the wrist compared to the elbow.
Is it proximal?
Very close. It is distal because the wrist is further away from the trunk compared to the elbow. Next, define superficial and deep.
Superficial means close to the surface, and deep means further from the surface, right?
You're getting the hang of it. How about when someone fell on their side hurting their right arm and right knee? What one word can be used to describe this injury?
Ipsilateral.
Okay, let's talk about angular movement and muscles. So first, rotation. It's really easy. It just means turning around along axis. There are two types. Medial rotation, the internal rotation towards the midline, and lateral rotation, which is external rotation away from the midline. Next we have adduction and abduction, which refers to moving towards or moving away from the midline of your body respectively.
Like if your friend grabbed your arm from the side, that would be abducting your arm.
Yeah. Then we have flexion, which is the movement when you decrease an angle between two parts at a joint. Like when you flex your biceps, you're decreasing the angle between your limb. On the other hand, when you're increasing the angle, like you increase the angle of your neck to look up to the sky, it's called extension. Now we come to the movement of body parts. Elevation is when a body part is moved upward. Depression is when a body part is moved downward. Protraction is when a body part is moved forward.
And retraction means moving a body part backwards.
Quiz time. If a soldier standing straight was to go into standard anatomical position, what type of rotation would his arm be in?
Lateral.
Correct. Now look at the photo of this ballerina. Is his left leg undergoing adduction or abduction?
Adduction.
Absolutely. When someone is doing star jumps from rest position, does their shoulder undergo extension or flexion at the start of the jump?
Is it extension?
Oh no, it's flexion, since you're talking about the shoulder joint. How about the act of shrugging your shoulders, depression or retraction?
Depression.
You're doing great. So now it's time for the musculoskeletal system. Let's start with muscles. Muscles shortens in length to contract, which results in movement, maintenance of posture, changes in shape, or propulsion of fluid through vital organs. There are three types of muscles. Skeletal muscles, also called the voluntary muscles, are striated muscle fibers attached to bone. Cardiac muscles are also striated. They're made out of walls of heart and proximal portions of great veins. Smooth muscles, also called involuntary muscles, are non-striated muscle fibers that line various organ systems like the urogenital. Before we get on the anatomy of the biceps, you will have to know some more terminologies. First, origin. It is the attachment point of muscle to the bone, which is often more stable and fixed.
However, insertion is the opposite and is attached to a more movable bone.
For innervation, it refers to the supply of nerves for that area. Now let's get to the core part. Some muscles have multiple muscle heads, which are due to multiple myofibrils in each muscle fibers. Biceps contains two heads, the long head and the short head, with the long head's origin being at the supraglenoid tubercle of the scapula towards the outside bone of your armpit, and the short head being at the coracoid processes towards the inside bone of your armpit. Both heads' insertion are at the radical tuberosity near the elbow.
And their innervation is from the C5 and C6 nerves. Biceps usually get their blood supply from the brachial artery and the circumflex artery.
Now we'll talk about hamstrings. They are a group of muscles in the posterior of the foot, consisting of the bicep femoris, which has a long head and a short head, the semitendinous, and the semimembranous. The origin of the hamstring is the ischial tuberosity near the pelvis and the femur, excluding the short head of the bicep femoris, which originates at the lateral supracondylar line. Meanwhile, the insertion for the semitendinous is the medial aspect of the proximal part of the tibia, while the semimembranous is the medial condyle of the tibia, and the bicep femoris insertion is the head of the fibula.
The innervation is controlled by the tibular division of the sciatic nerve, L5 to S2. The biceps femoris uses the common fibular division of the sciatic nerve. The blood supply is controlled by the perforated arteries of the deep femoral artery. Let's move on to the skeleton. The skeleton has many functions like movement with bones acting as levers for muscles, hematopoiesis, so blood cell production, where cells form in the bone marrow, and storage of calcium and phosphorus. There are two parts of the skeleton. The axial skeleton consists of the head and the trunk,
Well, the appendicular skeleton is everything else, which means limbs.
There is around 207 bones in infants, which eventually merge together to create 206 to 213 bones in adults. The range of bone number is caused by humans having a various number of ribs, vertebrae and digits, which means fingers and toes. The skeleton consists of bones and cartilage, with the bone being rigid tissues, which are mineralized. There are no neurovascular areas within the cartilage, and it gains nutrients by diffusion from the surrounding environment. I will take you through some bones in the skeleton. In your head you have the cranium, which is your skull, and your mandible, which is another word for your jaw. Your spine has 5 main parts, from top to bottom, or superior to inferior. They are cervical, C1 to C7, thoracic, T1 to T12, lumbar, L1 to L5, sacrum, S1 to S5, and the coccyx, CO1. The bottom part of your torso is your pelvis that looks like a heart. This includes the iliac crest at the northeast and northwest part of the heart, with your ilium sitting under that, your pubis being at the centre of the heart, the ischium being the 2 circles below the heart, and the ischial tuberosity, or origin of the hamstrings, being southeast and southwest of the heart. Now in your arm, in order to superior to inferior, you have the humerus above your elbow, then your radius and ulna in your forearm, with your radius being close to your thumb. In your hand you have carpals, metacarpals and phalanges, with your carpals being proximal in comparison to your phalanges, which are distal.
In your legs, you have your femur at the top, your kneecap or patella, and your tibia and fibula, with your fibula being more posterior than your tibia, as you leave your fibs behind you. Then in your foot, similar to your hand, you have your tarso, metatarso, and phalanges.
Now we'll talk about the humerus. It's the biggest bone in your body and is found in the arm. At the top you have the head of your humerus, followed by the greater tubercle and the lesser tubercle.
In the middle of the bone, you have the diploid tuberosity, which pokes out, and the radical groove on the opposite side.
Towards the bottom you have some fossa, which are caves, like the radial fossa, coronoid fossa, and the olecrayon fossa, as well as some supraepicondylar ridges, one lateral and one medial, as well as medial and lateral epicondyli.
Well, I think I get it now. So, like, planes, directions, movement, muscles, bones, they all link together.
Exactly. Anatomy is not just a list of terms. It's a way of mapping the body so we can all talk the same language. Once you get the hang of the foundations, everything builds from there.
And that's all for today's call on LifeLine. Thanks for listening, and remember, if you're struggling with your writer reading, we've got you covered. Until next time.